Imagine a variant of COVID-19 that accounts for nearly 30% of all cases in the United States. Quite an unsettling thought, isn't it? But unfortunately, this isn't a figment of imagination. It's the stark reality we're facing with the emergence of a new COVID-19 variant known as JN1. With its initial detection back in September, JN1 has been on a swift journey of multiplication and spread. It's like the new kid on the block who's taking over the neighborhood, and not in the most pleasant way. The Centers for Disease Control and Prevention has stamped JN1 as the fastest growing variant, a title that speaks volumes about its potential impact. But where did JN1 come from? It's like a sequel in the ongoing series of COVID-19 variants, with its lineage tracing back to the Omicron variant. Yes, JN1 is a descendant of Omicron, another variant that had its share of the limelight. However, it's not just the rapid spread of JN1 that's causing eyebrows to raise. What's equally intriguing is its ability to either transmit more easily or evade the immune system more effectively. It's like a cunning adversary that knows how to dodge and weave to keep us on our toes. But let's not jump to conclusions just yet. While the swift spread of JN1 is indeed a cause for concern, it's essential to remember that every story has more than one facet, and the story of JN1 is no different. The speed at which JN1 is spreading is a cause for concern, but there's more to the story. JN1 isn't just spreading fast, it might be playing tricks on our immune system too. This new strain of COVID-19 emerging on the scene is not just another variant, it's demonstrating some interesting and somewhat concerning characteristics. It's believed that JN1 might be more transmissible, meaning that it could spread more easily from person to person. This alone could account for its rapid spread and the increasing number of cases. But that's not all. There's also a possibility that JN1 could be better at evading our immune system. It's like a crafty infiltrator, slipping past our body's defenses and establishing itself before we even know it's there. This could potentially make it more difficult for our immune systems to combat the virus, leading to more severe disease in some individuals. Let's hear from an expert on this. Dr. Dean Blumberg, a pediatrician and a respected authority in this field, has expressed his concerns about the variant's rapid multiplication. He's also noted an increased proportion of isolates, or individual cases of the virus, detected in recent weeks. This suggests that JN1 is not only spreading quickly, but is also becoming a more dominant strain. What does all of this mean for us? Well, it means we have a new challenge on our hands. We're dealing with a variant that's not only spreading like wildfire, but also might be harder for our immune systems to fight. It's like a double-edged sword, cutting both ways and making our battle against COVID-19 that much more difficult. But remember, knowledge is power, and understanding the power of JN1 helps us prepare and strategize better. It's not about fear, but about awareness and action. So, as we continue to learn more about JN1, we'll continue to adapt, innovate, and do everything in our power to protect ourselves and our communities. This new variant is a formidable opponent, but how is it affecting our health systems? Let's delve into that in the next segment. Stay tuned. As JN1 spreads, hospitals are feeling the strain. But it's not all doom and gloom. The emergence of the JN1 variant is indeed causing a bit of a stir in our healthcare systems. We're experiencing an uptick in hospital admissions, a trend that has been observed since the variant was first detected. However, it's crucial to remember that the context today is vastly different from what it was a year ago. Back then, we were grappling with the unknown, trying to understand a virus that had taken the world by surprise. Fast forward to now, we're in a much better place to handle COVID, thanks to the lessons learned and the strategies developed over the past couple of years. One of the most significant game changers has been our increased immunity, largely owed to the widespread vaccination efforts and the immunity acquired from previous infections. This increased immunity has proven to be a strong ally in our fight against COVID. So, even though we're seeing a rise in hospital admissions due to JN1, the number of patients is actually lower compared to last year. This indicates that while more people might be getting infected, fewer are getting severely sick to the point of needing hospital care. It's a testament to the resilience we've built against the virus. Moreover, our healthcare professionals are now better equipped and prepared to handle the situation. They've been on the front line since day one, and their understanding of the virus and its treatment has grown leaps and bounds. This knowledge, coupled with our increased immunity, could be the reason why we're seeing lower patient numbers despite the surge in admissions. But let's not get complacent. We need to stay vigilant and continue doing our part. Get vaccinated if you haven't already. Follow the recommended safety guidelines. And let's help keep the pressure off our hospitals. So with hospital admissions up but patient numbers down, what does this mean for the general public? Well, it means we're making progress, but the fight against COVID is far from over. Let's keep pushing forward. In the face of JN1, the question on everyone's lips is, will the vaccines still protect us? The answer, thankfully, is a resounding yes. Current vaccines are proving to be a robust bulwark against this new variant. This is a testament to the power of modern medicine and the tireless efforts of scientists worldwide who continue to monitor and respond to these evolving threats. Let's delve a bit deeper into this. The JN1 variant is a descendant of the Omicron variant, which means it shares some genetic similarities. This is good news because it means that the immunity developed from the current vaccines or previous infection with the Omicron variant is likely to offer protection against JN1. Now, it's important to note that while vaccines are highly effective, they are not a magic shield. You might still get infected, but the severity of the illness is usually significantly reduced. Vaccines essentially train your immune system to recognize and combat the virus, minimizing the risk of severe illness, hospitalization, and death. But here's the rub. Vaccines can only do their job if they're actually in people's arms. That's why it's crucial for everyone who can get vaccinated to do so. It not only protects you, but also helps to protect those around you, including those who can't get vaccinated due to health reasons. As we approach the holiday season, it's more important than ever to ensure you're vaccinated not just against COVID-19, but also the flu. Coincidentally, the flu positivity rate is currently the same as COVID in places like California. Getting vaccinated against both viruses can help keep you and your loved ones safe during holiday gatherings. So if you're eligible and haven't yet received your vaccine, now is the time. If you're due for a booster shot, don't delay. Remember, it's not just about protecting yourself, it's about safeguarding our communities, our healthcare systems, and ultimately, our world. Vaccination remains our strongest defense against COVID-19 and its variants. With winter upon us, there's not just COVID to think about, but the flu too. As we wrap ourselves in warm coats and sip on hot cocoa, it's important to remember that we're also in the midst of flu season, alongside our continued fight against COVID-19. In sunny California, despite the beautiful weather, the state isn't immune to the reach of these viruses. The current positivity rates for both COVID-19 and the flu are telling a similar story. They're roughly on par with each other. This means that for every 100 tests conducted for each virus, about the same number are coming back positive. This is a crucial piece of information because it highlights the sustained prevalence of both these health threats in our communities. Delving a little deeper into the numbers, the overall COVID-19 positivity rate in California hovers at around 9%. To put that into perspective, that's almost 1 in every 10 tests conducted coming back positive. This points to a continued presence of the virus within the state, despite the concerted efforts to curb its spread. It's also worth noting that these figures are not just statistics. They represent real people, our neighbors, friends, and family members. They underline the importance of our individual and collective efforts to slow the transmission of these viruses. So what can we do with this information? Knowledge, as they say, is power. Understanding the current positivity rates for both COVID-19 and the flu empowers us to make informed decisions about our health and the health of our loved ones. It reminds us of the importance of vaccination, of maintaining social distancing where possible, and of practicing good hygiene. As we navigate the winter months and the holiday season, staying informed and vigilant is our best bet against JN1, COVID, and the flu. So let's continue to arm ourselves with knowledge to protect ourselves and those around us. Remember, we're all in this together.